Hello，朋友们，大家好。我们今天又来朗读英文。It's time for us to read out loud in English. Today we had an article is toenail fungus. Brenda and me, we will read out to
Hello,
you.
everyone.
Hello, Brenda.
Hello.
Yeah.
Hello, everyone. Hello, Yang.
Okay. Toenail fungus. Toenail fungus, known medically as onchomocosis 这个医学名词很难讲。onchomocosis, which also includes fingernails fungus, results in the nail becoming disfigured and sometimes destroyed. Different fungi, microscopic organisms related to mold and mildew can cause toenail fungus that thrives in dark, warm, moistured, and stuffy environments, such as those found in shoes. Fungi often enter through a crack or cut in your toe and feed on keratin, which is a protein making up the toenail's hard surface. The big and little toes are most affected because they receive the most fraction from the size of the shoes. Toenail fungus can originate from the same fungi involved with the athlete's foot, jock itch, and ringworm. Well, this fungus can infect both fingernails and toenails. Toenail fungus is much more prevalent. I don't know what is the word prevalent. Brand, yeah.
Facts on toenail fungus. It is responsible for about half of all nail abnormalities, according to the Canadian Dermatology Association. It is contagious. It affects estimated on 1 in 10 people worldwide, and men are more likely to get it than women. It is more common as people age, but children can also get it. About half of people 70 and over have experienced toenail fungus. With age, the nails grow more slowly and there is reduced ability to fight off infections. Nail fungus is usually harmless and potential for systemic illness is minimal. However, it looks unsightly and can cause discomfort when the nails become thickened.
Excellent.
Thank you.
Risk facts. Well, some people do not have any risk factors and still develop toenail fungus. Factors increasing the risk of toenail fungus include wearing tight-fitting shoes or tight hosieries, especially with the shoes made from non-breathable material, having minor skin injuries or injuries, trauma to the nail, prolonged exposure to moist conditions, using tools on nails used by others, practicing poor foot hygiene, letting your nails grow long or not cutting them properly can cause issues. Heavily using nail polish and wearing layers of nail polish. being in the military, a minor, or participating in sports, toenail fungi may spread from foot to foot on the floors of showers and locker rooms. Having conditions such as athlete's foot, psoriasis, excessive sweating, trauma, obesity, diabetes, circulatory problems, and a weakened immune system. Some people have a genetic susceptibility to toenail fungus, aging, spending a lot of time in the water.
Symptoms: unusually looking, irregular nails change in shape, a decolored toenail, yellow, green, brown, black, or white patches and streaks. A nail that is brittle and can crack, split, or crumble. 4. Smiling debris trapped under the nail. A loose or lifting nail. The thicker nail than before, overgrown. As the infection progresses, the nail plate can grow too thick, then it becomes difficult to thread. The nail appears dull and lacking shine. Redness and swelling ground the nail.
Diagnosis. A doctor will usually make a diagnosis based on the appearance of the nail. To confirm the diagnosis, they may take a sample of the nail and nail debris. Since other conditions can look like a toenail fungus, such as nail psoriasis or a mechanical trauma, it is essential to confirm a diagnosis. The sooner the diagnosis, the greater the chance of quickly and successfully treating the infection. Toenail fungus can spread to other nails or the skin, athlete's foot. Left untreated, it can progress to other skin infections or permanent damage to the affected nail. You can experience increased pain or discomfort, have trouble getting into your shoes, and have difficulty walking or standing.
Treatment. The UCLA Healthy website states, when it comes to treatment, the options are limited. Unfortunately, it is a challenge to treat this condition because of the thick nail plate barrier, high reinfection rates, growing resistance, boiling film formation, the way fungi create a protective community-like structure on and under nail, making it more challenging for medications to penetrate, and relatively low efficacy of most unforegone agents. Treatment depends on the severity and the type of fungus causing it. Whenever you have any other medical conditions, your preference and what medications you take.
Over-the-counter products. Toenail fungus is usually not serious and may be treatable at home. WebMD indicates that you can use over-the-counter OTC products for mild toenail fungus, but most are not potent enough to cure moderate to severe toenail fungus. You can consult your pharmacist for guidance on over-the-counter products. Success with OTC products depends on the severity of the infection, consistent treatment use, and individual response. The issues include limited nail penetration, slow improvement, and varied effectiveness.
Or
Hello?
make an
Yeah,
sorry.
go ahead.
Make an appointment with your family doctor or podiatrist if your symptoms do not get better with home treatment. If you experience severe symptoms, if the infection is spreading, or if you have an underlying health condition such as diabetes, poor circulation, or lowered immune system, as you are at a greater risk of complications.
Dr. Antonella Tosti, a dermatologist at the University of Miami Miller School of Medicine, tells the New York Times that the only option that kills the fungus is a prescription antifungal. The Canadian Dermatology Association indicates that severe or long-standing cases require prescription strength treatments. The GoodRx website notes that these treatments work slowly, so patience is required. Treatment steps include trimming and funning. Yes, go ahead.
Trimming and filing. Your doctor may remove as much of the infected nails as possible by trimming or filing it. For mild and minor infections, individuals can use a topical antifungal agent, for example, cream solutions or medical nail polish. These take up to a year to work, and the cure rate is only up to 20%. The Cleveland Clinic reports that topical medications are most effective when combined with the oral medications. There are far fewer side effects with the topical medications than oral medications. For infections that affect a wider area of a nail or multiple nails, you may be prescribed an oral antifungal fungal medications tabled. Oral medications are taken daily for 3 months with about 40% cure rate. The medication enters the network of blood vessels and survey the nail bed. Oral medications not only have side effects, but can also interact with other medicines, so they may not be appropriate for everyone. Dr. Torsty tells the New York Times that compliance is crucial when it comes to taking prescription medications. For several cases, a doctor may surgically remove the toenail. The Mayo Clinic notes that this is most effective, but the least used option. Please, could you
Okay.
read it?
Yeah.
Thank you.
Complementary and alternative treatment, such as wicks, VapoRub, tea tree oil, banana pills, vinegar soaks, spirulina, some essential oils, and Listerine. A 2022 review concluded that while preliminary evidence exists for several complementary and alternative therapies, the field studies have small sample size and are low quality. Much of the research is preliminary, lab trials, and a small group of people. The author called for large-scale randomized placebo-controlled trials before endorsing their use to patients with toenail fungus. While these remedies may not be as effective or work as quickly, they typically have fewer side effects than conventional medicated treatments, notes that GoodRx website. Jessica Milliman, DPM, a foot and ankle specialist, comments on the university hospital's website. These treatments work for some and not for others, but there is no potential harm in trying them. I always recommend that patients file down the top surface of the nail before trying any topical or homeopathic treatment to help the products penetrate the nail. Light therapy and lasers. More research is needed to determine their effectiveness. And once the fungus is gone, other steps to take include thoroughly washing and soaks or other clothing that was in contact with your first infection, and use a disinfectant spray or throwing out the shoes you wear when you had toenail fungus. Since they can have a high concentration of the fungal spores, the American Academy of Dermatology says that after the infection clears, you may be prescribed maintenance therapy that you apply at home to prevent another infection. When you eradicate the fungus, it can take from 12 to 18 months for a new and uninfected toenail to grow back in.
Prognosis. Harvard Medical School reports that toenail fungus is a chronic condition that rarely heals without treatment. Factors associated with a failure to achieve a complete cure included being over 70 and having a nail thicker than 2 mm. Even when the fungus goes away, the Canadian Dermatology Association reports that chance it will return is 25%. While the goal of treatment is a complete cure, people often have nail abnormalities before the fungal infection and will not have entirely normal nails after treatment.
Prevention. The university hospital's website points out that, as with most medical conditions, it is always preferable to prevent rather than treat. Since fungi are everywhere, you cannot completely eliminate the potential of developing a toenail fungus infection. Habits can reduce the risk, especially after treatment. Reinfection is unfortunately common. The goals are to practice proper hygiene and preventive habits. Avoid being barefoot as fungi lives everywhere. For example, home surfaces, bathrooms, gyms, public showers, saunas, or pools. Many people pick up fungi from walking barefoot in communal areas. Trim your nails short because longer nails prevent more space for nail fungi to hide. The Canadian Dermatology Association advises you to trim your nails straight across. Take a break from shoes and rotate shoes so they have time to dry out. If you do regularly fitness activities, it is worth getting 2 pairs of shoes that you can alternate. And invest in moisture wicking socks. Wash your hands and feet often after participating in sports. Use an anti-fungi spray or powder daily. Keep skin clean and dry. If you are getting a pedicure, bring your tools to the salon to reduce the risk of contamination. Do not share towels or wear other people's shoes. Treat athlete's foot to prevent it from spreading to your toenails. Properly sanitize your nails, clippers, and other nail grooming tools. Do not share these tools with others. Be sure other household members who may be infected are treated. If you have sweating feet, ask your doctor about treatment. Last but not least, Brenda, here.
Okay. Wash socks, bending and toes at 60 degrees Celsius or higher to avoid another infection. You can also use special laundry synesthesias that kill fungal spores at low temperatures.
Excellent. Yeah, this is
Sorry.
an article come out of the resources, so we don't need to read that part. This is an article we read. We not do the review, we just open it and read it right away. So you did very good.
Yeah.
So here's laundry. Laundries, we do the washing clothing called laundries, right? This is sanitizers. Sanitizers is something to kill the germ that has alcohol, some kind of smell. Okay, great. Thank you, Brenda.
Thank you much.
Thanks for the audience to listen. And we are going to read next articles. We stop this one.